I'd like to introduce Dr. Edmund O'Flaherty from Dublin in Ireland. Thank you for joining me, Edmund.
My pleasure.
Could you tell me when you first heard about LDN?
It's about 9 years ago when I came across it first. I'm always searching for new information, and the net was working quite well at that stage, and I came across it, and I got interested in it almost immediately, and over the years I have used it more and more.
Mm-hmm. And what conditions do your patients take LDN for?
It's an enormous range, actually, but I suppose the main ones I would see would be people with cancer and people with multiple sclerosis.
Mm-hmm. And what kind of results are your patients finding?
Well, they're still coming here. Some of them are coming a long time. For example, probably the most interesting case I have with cancer is a lady who has been coming here for, I suppose, she got breast cancer in '99. It spread to her lungs in 2002. And I put her on LDN soon after I read about it. And she's still alive 9 or 10 years later.
Right.
So it's an amazing story. The average life expectancy, in fact, in that case, is 2.5 years now. She has been receiving full treatment, but she's the first one I've seen surviving that long with metastases in the lungs.
Mm-hmm. And have any of your patients reported any side effects?
Yes, indeed, they have. Initially, they have difficulty getting onto the proper dose. The dose has been 4.5 milligrams in the tablet or liquid form for many years, but some of them get by on maybe 3 milligrams, and actually in recent times I'm heading a little bit towards regarding 4 milligrams as the standard dose for cancer patients. But really, beyond that, insomnia is a problem, especially early on, and they all record different side effects, no great significance. And if they've got something seriously wrong with them, they just get on with it, and after a while they have things managed pretty well.
Mm-hmm. So after a while, I should think it's the same as with most people, the side effects tend to go.
They get it down back to a level again where they're comfortable, and they maybe move up a little bit slowly,
mm-hmm.
and they may get up to the full dose.
So in your experience from the patients that you've prescribed LDN for, what would you say the success rate has been?
It varies very much. I have one case of Crohn's disease which I've seen, and he's recovered beautifully. That is 100% success. But I've never seen any other case. Now, this was a young man in his early 30s who had this terrible bowel trouble, pain and bleeding every day for maybe many years, and then within a few weeks of starting on LDN, it just disappeared. He's been well since. He's on nothing else except LDN. I saw him only a month or two ago, and he's still doing very well, with no side effects, no expensive drugs, except for taking the LDN. He has to take no medication at all.
Mm-hmm.
But that's the most successful one. Now, beyond that, many of the cancer patients are obviously just hanging on at this stage, but many of them are doing really well, and there's one man, for example, that comes to mind. He's about 7 or 8 years ago. He was told after the operation he had bowel cancer. He came to me about 6 months after he got it, and I told him to go straight to the hospital. Now he waited 6 more months, and after the operation was done, then the surgeon came out and called the man an idiot, basically, for wasting a whole year. But I put him on LDN then, actually, and he's still alive and well, and no relapse after about 6 or 7 years. So you get lots of beautiful stories like that, actually, where people seem to get by, and it gives them confidence as well. They've got some hope. Mm-hmm. Sometimes the specialists don't give them much hope, and with this I give them a little bit more, and that in itself is good for them, I think.
Mm. And do many of your patients stop taking it?
Some of them stop after a few months. I think the cancer patients, if they get through the next year or two, very often they think they're cured and they just don't bother. And there's a natural tendency anyway to not to bother with medication, try to forget things. If they're doing fine, they just don't bother anymore. Certainly that does happen, even with cancer patients who would be potentially the greatest beneficiaries of all if they just stuck with it.
And do they come back to you?
Well, they do sometimes when they come for something else, and I suggest maybe beyond the stage that they should probably continue on it. As well as that, of course, if you've got one kind of cancer, you're more likely to get another cancer, so they should be aware of that fact and try to protect themselves for the long term, I think.
Mm-hmm. So how would you summarise LDN in your professional opinion?
in my experience, it's been a very valuable addition to my repertoire. And I couldn't really get through a week without prescribing it for somebody new, I would say. And sometimes I see several new patients in a week. Now, I live in Dublin, so I get patients from all over the country and occasionally from other countries indeed. And I start off with many people, and then I tell them to get a doctor near them after that. Now, some of them come and see me again, but because they come from very far away, I do advise them to get somebody else to continue with it.
Mm-hmm.
But on the whole, it's been a great asset to my practice, really, and has given my patients a lot of confidence in the future. Because it covers so many things, I get a wonderful variety of problems coming my way, and we try it in many cases to see what would work. And amazingly, sometimes it does. And an interesting other thing I've noticed is this. Sometimes you might meet Joe Soap, who's got some kind of cancer, and we give it to him, and then you discover that his brother gets it from him. It spreads around the family. Sometimes you come across a family with 3 or 4 people taking it for this, that, and the other. Mm-hmm. They all claim they're getting benefits from it. So it's something that obviously it does please a lot of families as well as just individuals.
Well, thank you very much for being such a supportive advocate of LDN. And
so one other interesting point I've got to make is I do a little bit of autism treatment, and I saw one child who had no words at all at 6 years of age, and after about 6 months of LDN, he has 200 words. That was really exciting. And the first word he had said was plain. He was understanding lots of things, but he couldn't say the word. But then it just shot out of him in a few weeks after he started taking the LDN. Okay?
That's lovely. Well, long may you be prescribing LDN. We
Thank you very much indeed.
Do without you.
Bye now.
Thank you.
Bye.
Bye-bye.